Hi, I'm Dr. Abby McEwan. I'm a facial plastic surgeon here at ImageLift. So what really inspired me to become a facial plastic surgeon was an event or an encounter that I had during surgical residency. So I was on a rotation where we were doing a lot of skin cancer reconstruction. And I remember there was one patient who had a very large skin cancer removed, requiring multiple stages of reconstruction to restore the structure, function, and appearance of her nose. And just seeing the progression that she went through throughout that process that was eventually able to restore her confidence, her quality of life, and just kind of see her come back into the person that she was prior to that cancer diagnosis was really inspiring. Then as I progressed throughout the field, there were more and more things about facial plastic surgery that were just so captivating because it was really an opportunity to help patients become the person they really were, at one point, or the person that they really wanted to be. So my experience started with my training mostly in the Midwest. So I attended medical school at the University of Missouri and subsequently did a surgical residency at the University of Missouri in ear, nose, and throat, where I was exposed to facial plastic surgery and fell in love with it. So then I did a facial plastic surgery fellowship in Princeton, New Jersey, where I was actually exposed to hundreds of cases involving aging face, facelift, aging eyes, blepharoplasty, eyelid surgery, rhinoplasty, all cosmetic procedures involving the face. And after that, we moved to Florida, and I've been in practice, ultimately joined Dr. Rich. I've been in practice for about 15 years. I've done over 200 facelift surgeries. Each facelift technique is a little bit different. And so I have experience with a vast array of multiple techniques to specifically address aging face concerns. And that number continues to grow very quickly. My favorite thing about being a facial plastic surgeon is seeing patients go through the journey of making the decision to do something for themselves, going through the process, going through the recovery, taking care of themselves and putting themselves first for once, and then seeing how they transform after surgery. So one of my favorite things to see is a patient coming in a month or so after surgery and they just look like themselves again. They look confident, they dress up typically, their posture is better, everything about them just screams happiness. And that is by far the best thing about this practice. I've always thought that one of the things that makes me a little bit different from other surgeons is that I really try to listen to patients when they come in and we meet for the first time, figure out what is their why, figure out exactly what their goal of surgery is, and try to figure out the best way to accomplish their goals. I think that listening to patients and trying to just develop that relationship up front is something that gives me just a lot of insight into how the surgery that we're going to perform for them really will impact them, and it really makes that whole journey just a lot more seamless. Surgery and recoveries from surgery can be a little bit difficult sometimes, and so being able to have that trusting relationship to get them through that and really just give them the best result possible is one of my favorite things about being a facial plastic surgeon. I would say the most popular treatment that I perform is a facelift. A facelift accomplishes so much that we really just can't do with other procedures like fillers and non-invasive types of procedures. So it's really just the best way to give patients the benefit of the more youthful facial appearance, better neckline, better jawline. My favorite combination treatment is actually facelift surgery with an upper blepharoplasty plus or minus a lateral brow lift, depending on if the patient needs that, combined with laser resurfacing. Oftentimes we will also do some type of filler just to help with volume restoration and balancing the upper face with the lower face. Those three, surgical, laser resurfacing, and filler, is by far the best combination that I think we do for patients. The best way to determine what procedure is going to be right for you is by consulting with a facial plastic surgeon. We're able to look at you and your unique anatomic features, what your goals are, what you're trying to accomplish, and come up with a very customized game plan to meet your goals. Absolutely. Our number one goal is to ensure that you have a natural looking result. The best facelift looks like you've never had a facelift. So scars form and kind of mature over the course of several months, but the great thing about the scars that we use in all types of our procedure is that they're hidden. Most of the scars are hidden either in the hairline for a facelift procedure, in the upper eyelid crease for an upper blepharoplasty, underneath the chin. So we do our best and we really pay particular attention to where the scars are placed. And then also during the surgery, one of the biggest things that we're paying attention to is meticulous closure of those scars so that they heal in the best way possible. So your best results are really going to depend on what your goals are, your anatomy, your genetics. And so that's why meeting and consultation is so important to come up with that game plan. In general, the best results are going to come from combination treatment, meaning that we're implementing surgical maneuvers, laser resurfacing, and volume restoration, typically in the form of fillers or injectables. So my favorite patient story actually was a couple years ago when I actually performed a facelift on two best friends. So they had both unfortunately lost their husbands a few years before their surgery. They made this pact that they were going to put themselves first, have the surgery that they had always dreamed of. And I ended up operating on one patient the first day and the other patient the second day. So they went through the entire process together. They were so thrilled with their results and just so happy that they had made the decision to go forward with the procedure that when I saw them for their 1 month post-operative visit, when we were reviewing their photos, they actually started crying and stood up and just started giving a standing ovation because they were just so happy and proud of themselves for putting themselves first. So in my free time, I really enjoy doing basically anything outdoors in the beautiful Florida weather. I take my dog for walks, generally 2 times a day, because he basically mandates that. I also like to go running outdoors. And the other thing that I really enjoy is baking. So anytime I'm just not feeling quite like myself or I have a lot on my plate, I just get into the kitchen and make something. So when I first came to this practice, one of the things that was just really striking to me was the fact that the entire practice is centered on facial plastic surgery procedures. Facelift, obviously, other facial procedures such as lip lift, brow lift, blepharoplasty, a number of other things that we can do to accomplish the goals that patients come in regards to their face. And I think that the practice has been built specifically with that in mind, and it really shows. The other thing that is so important about ImageLift is that the entire team is focused solely on the patient. So there's a team of 40 people, and every single one throughout their day-to-day is going to put the patient first. Make sure that the patient is having the best experience, patient's questions are answered, patient's goals are met. And the fact that the procedures are all performed under local anesthesia only is unique. So this is the largest local anesthesia facial plastic surgery practice in the country. And in my opinion, not only is it the safest way to do those procedures, it also gives the best results and the best patient experience. I'm excited to begin this journey with you. I'm here for you. If you have any questions or concerns, please give me a call.